Hello to everyone watching us on various WHO platforms. Also welcome to all journalists joining us through online connection for this regular press briefing from WHO headquarters in Geneva on COVID-19. Before I give the floor to Dr. Tedros, I will just remind you that the question and answer session will start immediately after, and that question should be one per journalist and very concise. We do have an interpretation as we had in the previous days. We also have sent you a number of products from different WHO offices on different topics. So I will start by giving floor to Dr. Tedros.
Thank you, Tariq Hvala. Good morning, good afternoon, and good evening. First of all, I would like to welcome all Hindi-speaking journalists, and we look forward to your questions. In total, WHO press conferences are now available in 8 languages, all 6 United Nations languages, plus Portuguese and Hindi, Namaste, plus closed captions for people with hearing loss. More than 3.5 million cases of COVID-19 and almost 250,000 deaths have now been reported to WHO. Since the beginning of April, an average of around 80,000 new cases have been reported to WHO every day. But these are not just numbers. Every single case is a mother, a father, a son, a daughter, a brother, a sister, or friend. Although the number of cases reported from Western Europe is declining, more cases are being reported every day from Eastern Europe, Africa, Southeast Asia, the Eastern Mediterranean, and the Americas. However, even within regions and within countries, we see divergent trends. Every country and every region needs a tailored approach. But the impact of the pandemic goes far beyond the numbers of cases and deaths. Around the world, the pandemic has caused severe disruption to essential health services, including to community-based health care. Also, professional health workers, like doctors and nurses, play crucial roles. In many countries, trained members of the community play a vital role in delivering essential health services like vaccination, prenatal screening, and the detection, prevention, and management of many diseases. Today, WHO, UNICEF, and the International Federation of the Red Cross have published guidance for countries on how to maintain community-based healthcare in the context of COVID-19. It includes practical recommendations for countries on sustaining essential services at the community level, leveraging community health workers for the response to COVID-19 while keeping them safe, and advice for how to adapt services for specific diseases and age groups. For example, it suggests using telemedicine wherever possible and leaving insecticide-treated nets for malaria at the door of households instead of asking people to collect them from a central location. It's also vital that countries pay careful attention to the most vulnerable members of their societies. Crisis can exacerbate existing inequalities, which is demonstrated in higher rates of hospitalization and death among certain populations in many countries. We must address this now and in the long term by prioritizing diagnosis and care for those who are most at risk. This is not only the right thing to do, it is the smart thing to do. We cannot end the pandemic until we address the inequalities that are fueling it. Today's guidance complements the United Nations Framework for the Socio-Economic Response to COVID-19, published last week. The framework lays out a recovery roadmap for countries to protect lives and livelihoods. I repeat, lives and livelihoods, and get businesses and economies up and running again as soon as possible. Importantly, the framework takes a health-first approach, recognizing that strong and resilient health systems must be the foundation of recovery in all countries. As more and more countries consider how to ease the so-called lockdown restrictions, I want to reiterate the 6 criteria that WHO recommends countries consider. First, that surveillance is strong, cases are declining, and transmission is controlled. Second, that health system capacities are in place to detect, isolate, test, and treat every case and trace every contact. Third, that outbreak risks are minimized in special settings like health facilities and nursing homes. Fourth, that preventive measures are in place in workplaces, the schools, and other places where it's essential for people to go. And fifth, that importation risks can be managed. And sixth, that communities are fully educated, engaged, and empowered to adjust to the new norm. The risk of returning to lockdown remains very real if countries do not manage the transition extremely carefully and in a phased approach. The pandemic has highlighted the importance of strong national and subnational health systems at the foundation of global health security and universal health coverage. Strong and resilient health systems are the best defense not only against outbreaks and pandemics, but also against the multiple health threats that people around the world face every day. And yet, on current trends, more than 5 billion people will lack access to essential health services by 2030, including the ability to see a health worker, access to essential medicines, and running water in hospitals. Gaps like this don't just undermine the health of individuals, families, and communities. They also put global security and economic development at risk. The world spends around US 7.5 trillion on health each year, almost 10% of global GDP. But the best investments are in promoting health and preventing disease at the primary healthcare level, which will save lives and save money. Prevention is not only better than cure, it's cheaper and the smartest thing to do. The COVID-19 pandemic will eventually recede, but there can be no going back to business as usual. We cannot continue to rush to fund panic, but let preparedness go by the wayside. As we work on responding to this pandemic, we must also work harder to prepare for the next one. Now is an opportunity to lay the foundations for resilient health systems around the world, which has been ignored for long. That includes systems to prepare, prevent, and respond to emerging pathogens. If we learn anything from COVID-19, it must be that investing in health now will save lives later. History will judge all of us, not only on whether we got through this pandemic, but also on the lessons we learned and the actions we took once it was over. And then before I end, I will just repeat something that I said many times. The antidote for this pandemic is national unity and global solidarity. Together, we will defeat COVID-19. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks, and we do indeed welcome Hindi speakers to our press conference. Again, we are working with Zoom that has particular technical modalities. So, for example, Arabic speakers need to go under Korean language if they want to choose Arabic language, while for Hindi speakers they have to go to Japanese language. So hopefully this thing will get better as we move forward. Also, for the time being, Hindi speakers can only listen, and then questions will have to be said in English, but we also work on that. In any case, it's very good that we can reach to more and more people. So before we go to question, I would just like to remind everyone that we need to be very concise and one question per person. So I'll just check with my colleague Chris who we would have first in line, and let's go with Ankit from India today. Ankit, you have the floor.
Good evening. My name is Ankit Kumar. I represent India today. My question is on contact tracing applications. More and more countries are rolling out their own versions of these applications. Is there any data or study, or can you tell from your own experience if these applications are helpful in controlling the pandemic threat? In your opinion, should these apps be mandatory for those going out on work during the lockdowns, as the case is in India? Thank you.
Thank you, Ankit. This was about contact tracing applications.
So I could start, and perhaps Mike or DG would like to supplement. So thank you for the question. Contact tracing remains one of the fundamental tasks that need to be done to help control transmission of COVID-19. And what we mean by contact tracing is when you identify a case through your surveillance systems, that you identify all of the contacts, all of the people who are in contact with that known case, and then you follow them over 14 days. Your question was specifically about apps, and apps can supplement the work that needs to be done by people. The work that needs to be done by individuals who can go out and actually interview cases and find out who did they come in contact with just before they became symptomatic and while they were symptomatic before they were isolated. And that needs to be done by a group of individuals, and many of them are trained in epidemiology, but you don't have to be trained in epidemiology. We've seen many countries use different workforces, volunteers who are trained, school teachers we've heard of students who can help with this contact tracing. And what's important about an individual, the people that do this, is that you need to find cases through personal interaction and through interviews, all done physically distanced, of course. The apps can help, but they don't replace people who need to do that contact tracing. And what we're seeing is a lot of apps and a lot of applications that can help find people who may have been around somebody if they're using smartphones within a certain distance, and that can help narrow down the number of contacts, but it doesn't replace the individuals who actually have to go out and do the contact tracing.
Yes, just in supplement, there are different applications out there and many countries have developed them, many consortia have developed them, and in academia and the private sector. There are apps out there that help people learn about the disease, and there are some very useful apps out there that provide better information about the disease and good information, and that also, in some cases, help people check their symptoms. In other words, allow people to get information regarding the symptoms of the disease, check their symptoms, and see if they should take further action. There are also mobility tracking applications where people doing modelling, and you've seen that with IHME in the US and other modelling institutions, where in the background they're checking the overall mobility of the population, which helps drive the modelling and prediction of disease. Because clearly, if people are more mobile and mixing more, you can use that to make your model more accurate about the likely future incidence of the disease. And then there are the apps that can help with contact tracing. And that's the many countries, the UK, I think, have just finished testing their app. What that app allows public health authorities to do is to, number one, potentially, in Korea have a similar application, is help with the tracing process. Once someone is sick, what would normally happen is they'd be tested and isolated. As part of that process, the public health authorities will ask them about who they've been in close contact with in the previous days. And that is a difficult process, remembering exactly who you spent a certain amount of time with in certain settings to see who the high-risk contacts might have been. A way to supplement that is to have an ability to use mobile phone technology that can actually remember, in a sense, for the person, because your mobile phone can remember who you were close to in the last number of days, and it can actually calculate how long you've been close to that person. So what it does is it provides an aid to memory for that process, and that can be very good. It can also be used to notify those contacts that they have been in contact with a confirmed case, which allows them to take appropriate action. For all of this to obviously work, it involves the Bluetooth function on people's mobile phones to be activated and people to accept that they wish to use this application. And I think that's where we have an opt-in process, many countries have an opt-in process for that. Each country is using a slightly different application with slightly different opt-in or opt-out processes. And obviously, countries have to take very good care of the fact that tracking people's location needs to be done for the sole purpose of COVID-19 response, and that is something that is being discussed actively in each country. From our perspective in WHO, we are working with many of these developers around the world and looking at these applications and then trying to establish applications or bots that we can offer to countries who they can adapt for their own use should they wish to. A good example of that is the Go Data application, which is a contact tracing system that allows countries to maintain a very sophisticated database of contacts, cases, lab results, and allows public health authorities to construct transmission chains and manage the whole process of contact tracing. We have made that application available to all countries, and many countries are now using that as a way of managing all of the data around cases. That does not involve individuals' mobile phones being tracked in any way. That's just purely to aid the process of contact tracing and the process of integrating all of the data. And one of the weaknesses in this whole response, or one of the challenges, has been how do you integrate data from the hospital, data from the public health system, data from the lab. And you've seen the frustrations when people say, we don't have the data, or where is the data? Very often the problem is that different parts of the health system are generating data for different purposes, and that data doesn't come together in a way that helps drive the response, and it takes time for that to happen. So applications that are assisting with that are extremely useful. So I would just like to clarify, it isn't one app, it isn't one way of doing things. Each and every one of these applications needs to be looked at by national authorities and to see how the app can help them do a better public health job of testing, tracing, tracking.
Thank you very much, Dr.
Merci beaucoup à tous les deux.